This is oxymetazoline to open up the passage.
What medication do you take?
Lisinopril and metformin.
Ozempic, Wegovy.
No, kind of expensive.
I'm going to squirt some numbing gel in your nose. If it drips back in your throat, that's okay. Here, in case you need it.
Do you smoke? Alcohol?
Never.
Do you exercise?
Moving from the bedroom to the kitchen. No, I'd walk more, but I'd need a bench to rest on every block.
What about water aerobics?
Let's focus on helping Mr. Knox.
Agreed.
Took me 25 years to get this way. Car crash, burn unit, 4 leg surgeries over 10 years. Laid me up so much I lost my job.
I need to numb the back of your tongue. This is gonna taste pretty bad.
Is there anyone you'd like us to call?
Any family?
My parents passed. I'm single. Go figure.
Siblings?
Sister in Arizona. We don't talk much.
Now that we've numbed up the back of your tongue, we can anesthetize a bit deeper.
Dr. Zach, I know you've watched my Pit React videos. You know how detailed I go with literally every single scene. So getting an airway specialist like yourself to comment on an actual airway is amazing. So feel free to tear this apart. Feel free to do what I do to all these Pit videos and just critique it hard. Have at it.
I will say one thing they haven't really mentioned though is some level of sedation. You can do this on an awake patient, but to not give them some level of sedation, it just kind of seems cruel to me. Like, a little Versed or something, just something so they're like chill. Maybe some ketamine, I don't know. That's the only thing I've seen that's missing so far, but also doing it completely awake is a thing. More so when people are kind of unstable and they can't tolerate any level of sedation. The plastic tube thing they stuck in the mouth to numb up the vocal cords, we call that an LTA or lidocaine topical applicator, and we do use that for these procedures and something very similar. One thing that they haven't mentioned or done yet that I really prefer to do when I'm doing awake intubations, especially on someone that might be a difficult airway, is a transtracheal block. You take lidocaine. I take an angiocath, usually just a 20 gauge is all you need, but I make sure it's an extra long one. And I go ahead and I put it in there, and then I thread the catheter in. I take the needle out, and then now you have a landmark in case you need to do an emergency crike or something. You already have a pathway. You've already done it. Like at this point, if you wanted to, if it's a very severe instance of an emergency airway, you can just pass a wire through and do your cell dinger technique and get a percutaneous trach in there, right?